Hi, my name's Matthew Leeks and welcome to this introduction to the FATES grant. The grant is entitled Remote and Aboriginal Cancer Care, Putting Training at the Centre, and it's a fellowship project to develop a program of post-fellowship training in remote and indigenous cancer care. FATES stands for Fellowship and Advanced Training in Extended Settings, and the grant is hosted by the RACP. So, introduction from Alice Springs, and I would like to acknowledge the elders of the Aranda people whose land I work and live in particular, the contribution of Ken Lecknider, who's our Aboriginal communications specialist. Now, we have two major grants that relate to improving remote Indigenous cancer care. The MALPA grant is from Cancer Australia and is about improving practice. The FATES grant is from the RACP and about improving training, and these two processes interact with each other. FATES has three major parts: development of a training network, developing a curriculum of remote Indigenous cancer care, and providing Indigenous trainee support. Now, this is situated as post-fellowship training with the idea of developing remote and Indigenous cancer care as a subspecialty, same way that people do subspecialty fellowships in respiratory oncology. The questions that we're asking for the curriculum are, firstly, what are the knowledge, skills, attitudes and habits that are required for an entrustable professional activity in remote Indigenous cancer care? Secondly, what are the underlying capabilities that enable the acquiring of these extended competencies? And thirdly, what practice frameworks support these capabilities? So the structure we have chosen for curriculum development is to develop an EPA, or an entrustable professional activity, which is to provide remote and Indigenous cancer care. Entrustable professional activity is a key clinical task that can be assessed, and the EPA structure is to use the different domains in the curriculum. Here we've used the 10 domains of the RACP wheel, and to match each domain with some advice about what performance is required to achieve competence in this domain. The major issue that we have with practicing in remote Indigenous cancer care is what you would call contextual errors. What could be the right practice in a city, the cancer centre, which is a poor practice when applied to a patient from a remote setting or an Indigenous patient. This is the question that the curriculum needs to address. In order to do this, we've built a network that starts with our local providers in Alice Springs, but also connects out to specialists in remote care like ACRM and Indigenous cancer care like AMSANT and the UQ First Nations Wellbeing. It's tied together by some of our clinical networks, particularly the NT Cancer Network and the NTSA network. Progress that we've made so far is that we've developed a draft of a competency-based curriculum through a process of iterative consultation, and we are now seeking advice about that curriculum. And to work through some of the results, here's an example of what the knowledge guide might look like, some of the sorts of knowledge that you need to practice in a remote location, which are not covered by existing curriculum. In terms of the underlying capabilities, we've identified a short list. Here's some of the candidates. Refining this list is the key to identifying what our education needs to achieve. And in terms of useful practice frameworks, the one that we've settled on as most helpful is a strength-based approach to cancer care. But there's a bit of work that's needed to be done to see what that looks like and how it overlaps with other frameworks, and particularly what the practical implications for practicing in this way are. So what we're aiming to do is to communicate at the moment some awareness of what we're doing, and to really call out for collaboration in this space from other people who are interested in these questions. We're also looking for advice about endorsement, integration and dissemination. So thank you for your interest. Any queries, please email me matthew.links@nt.gov.au. This is an important issue, and in order for us to improve, we're going to need better practice and better training. Thank you.